Hello guys, welcome back to my channel The Physiosapien, and in this video we will learn about the biomechanics of shoulder complex. In the last video I told you that shoulder is a complex joint. So what is a complex joint? Complex joint is a joint formed by three or more bones and an articular disc. So what all bones include in the shoulder complex? They are sternum, clavicle, humerus and scapula. The joints formed by the combination of these bones are sternoclavicular joint, acromioclavicular joint, glenohumeral joint and the scapular-thoracic joint. The scapular-thoracic joint is a functional joint. What is a functional joint? We will come to that later in the video. So, the first joint we are going to talk about is the sternoclavicular joint. The sternoclavicular joint is a plain synovial joint and it has minimal mobility, but it plays an important role in connecting the axial skeleton with the appendicular skeleton and thus helps in the transmission of weight to the axial skeleton. It has 3 degrees of motion, that these are the elevation and depression, retraction and protraction, and anterior and posterior rotations. The important ligaments which helps in the stability of these joints are anterior and posterior sternoclavicular ligament, bilaminar costoclavicular ligament, and interclavicular ligament. So the first movement at the sternoclavicular joint is elevation and depression. Here the convex end of the clavicle is in contact with the concave end of the sternum and elevation and depression of the sternoclavicular joint occur with respect to the lateral end of clavicle. So here they are in contact. So elevation and depression with respect to the lateral end of the clavicle. Here I have made a table regarding all the kinetics and kinematics of elevation and depression. So movement of clavicle with respect to the lateral end and the medial end, its range of motion and the muscles involved in that movement. So during elevation, the lateral end goes up and the convex end of the clavicle rolls superiorly and glides inferiorly according to the concave convex rule, and the range for the same is up to 48 degrees, and the muscles which help in this movement are levator scapulae, upper trapezius and the rhomboids. Similarly, during the depression, the lateral end of the clavicle moves downwards while the medial end rolls inferiorly and glides superiorly according to the concave convex rule. The range for the same is passive range for up to 15 degrees, and the muscles responsible for this movement are pectoralis minor, lower trapezius and the inferior fibers of serratus anterior. One thing to note is that no movement in the sternoclavicular joint is independent. They occur with the movements of scapula. So the next movement is protraction and retraction, which occurs around the vertical axis. Here the convex surface is the sternum while the concave surface is the clavicle. So the convex surface of the sternum with the concave surface of the clavicle moves to produce protraction and retraction. So for the lateral end of clavicle moves anteriorly in protraction while the medial end rolls and glides anteriorly according to the concave convex rule. The range for the same is 15 to 20 degree and the muscles acting are pectoralis minor and serratus anterior. So how does the protraction movement look like? So here the sternum, clavicle, this is protraction, the lateral end moves anteriorly, while this is retraction, the lateral end moves posteriorly. So the retraction, in retraction the lateral end moves posteriorly while the medial end rolls and glides posteriorly. The range for the same is 30 degree and the muscles acting are middle trapezius, latissimus dorsi and rhomboids. Now the third degree of freedom for sternoclavicular joint is anterior and posterior rotation. It occurs between the saddle shaped surfaces and inferior conus of medial clavicle. So this is the saddle shaped surface and this is the inferior conus of the medial end of clavicle, and the manubriocostal facet and disc of the sternum. So this is the manubriocostal facet and there is a disc between the manubriocostal facet and the clavicle. Now the anterior rotation The clavicle rotates in the anterior direction while the inferior surface of clavicle faces posteriorly. The range for the same is less than 10 degrees from neutral, and the muscles involving are upper and lower trapezius and inferior fibers of serratus anterior. So how does this movement look like? So this is the neutral position. Now this is anterior rotation, it is hardly 10 degrees, and this is posterior rotation, which is around 50 degrees. Now in posterior rotation, the clavicle rotates posteriorly, the inferior surface of clavicle faces anteriorly, the range is 50 degrees from neutral, the muscles involving are levator scapulae, latissimus dorsi, pectoralis minor and rhomboids. So this is the clavian groove is on the lower surface of the clavicle. So whenever there is anterior rotation, it faces posteriorly, while whenever there is posterior rotation, it faces anteriorly. One thing I want to mention is that sternoclavicular movements are not isolated movements. These occur with respect to the acromioclavicular joint movements, and thus the lateral end of the clavicle moves, resulting in all these movements. So the next joint of the shoulder complex is the acromioclavicular joint. It is a plain synovial joint and is composed of the lateral end of clavicle with the acromion process of scapula. It helps in the transmission of forces from the upper limb to the clavicle. The ligaments which help in the stability of the joint include the superior and inferior acromioclavicular ligament and the coracoclavicular ligament. The 3 degrees of freedom in which this joint moves are the internal and external rotation, anterior and posterior tilting, and upward and downward rotation. So the first movement of the acromioclavicular joint is internal and external rotation, which occurs around the vertical axis. What is the significance of the internal and external rotation? It helps in maintaining the contact with the horizontal curvature of the thorax as the clavicle protracts and retracts. The range for the same is 20 to 35 degree during arm motions, and it can go up to 60 degree with full range of motion. So here we have our scapula, and this is the neutral position of scapula, while this is your external rotation and this is your internal rotation. Okay, so when there is protraction of clavicle, the scapula undergoes internal rotation, while when there is retraction of clavicle, the scapula undergoes external rotation. So the next movement of the acromioclavicular joint is anterior and posterior tilting. It occurs along an oblique coronal axis. It helps to maintain the contact of scapula with the contour of thorax and to orient the glenoid fossa be relative to the humeral head during elevation and depression. The range of the same is 60 degree in cadaveric AC joint, means the available joint range is 60 degree. But during movements, it is only 20 to 40 degree during the full range of flexions to extension. So here we have our scapula. So this is our anterior tilting and this is our posterior tilting. The third movement of the acromioclavicular joint is upward and downward rotation. It occurs along the oblique anterior posterior axis. So the upward rotation occurs during abduction and flexion of the arm, and the range for the same is 30 degrees, while the downward rotation occurs during adduction and extension, and the range is 17 degrees. So this is the upward rotation, while this is the downward rotation. So thank you guys for watching this video. In this video, we have studied about the sternoclavicular joint and the acromioclavicular joint. We have studied about what type of joints they are, what are the articulating surfaces, the ligaments, the kinetics and kinematics of these two joints. In the next video, we will be studying about the glenohumeral joint. And thank you for watching this video. This is Ronak Chandak signing off.